Nicardipine Hcl is a medication used to treat high blood pressure, which can help prevent strokes, heart attacks, and kidney problems. It is also used to prevent certain types of chest pain, and may help increase your ability to exercise and decrease the frequency of angina attacks. It is important to take this medication regularly to be effective, and it should not be used to treat attacks of chest pain when they occur. Be sure to consult your doctor or pharmacist for details on how to use this medication. When taking Nicardipine Hcl, it's important to follow your doctor's instructions. Typically, you'll take this medication by mouth, either with or without food, 3 times a day. Your doctor will determine the right dosage based on your medical condition and how you respond to the treatment. It's important to take this medication regularly to get the most benefit from it, so try to take it at the same times each day. Even if you start to feel better, continue taking Nicardipine Hcl as prescribed. If you have any concerns or notice your condition getting worse, such as high or increasing blood pressure readings, more frequent or severe chest pain, be sure to consult your doctor. If you experience dizziness, lightheadedness, headache, flushing, or swelling ankles/feet, it's important to let your doctor or pharmacist know. To reduce dizziness and lightheadedness, be sure to get up slowly when rising from a sitting or lying position. This medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential side effects. It's important to note that many people using this medication do not experience serious side effects. However, it's crucial to contact your doctor right away if you experience any serious side effects, such as fainting, fast/irregular/pounding heartbeat, or vision changes. Although this medication is effective in preventing chest pain, some people with severe heart disease may rarely develop worsening chest pain or a heart attack after starting this medication or increasing the dose. It's important to seek medical help immediately if you experience worsening chest pain or symptoms of a heart attack. While a very serious allergic reaction to this drug is rare, it's important to seek medical help if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. Before taking Nicardipine Hcl, make sure to inform your doctor or pharmacist about any allergies you may have. Also, let them know about your medical history, especially if you have a certain heart problem, liver disease, or kidney disease. If you are planning to have surgery, make sure to inform your doctor about all the medications and products you are using. Nicardipine Hcl can make you feel dizzy, and alcohol or marijuana can increase this effect. Avoid driving or using machinery until you know how this medication affects you. Limit alcoholic beverages and talk to your doctor if you are using marijuana. If you are pregnant, only use this medication if it is clearly needed, and discuss the risks and benefits with your doctor. It is also important to consult your doctor before using Nicardipine Hcl if you are breastfeeding. It's important to be aware of potential drug interactions when taking Nicardipine Hcl. Certain medications can affect how nicardipine works in your body, such as cimetidine, antifungals, antibiotics, and St. John's wort. It's important to inform your doctor and pharmacist about all the medications and herbal products you are using. Additionally, some products may contain ingredients that could raise your heart rate or blood pressure, so be sure to speak with your pharmacist about using them safely. Remember to never start, stop, or change the dosage of any medicines without your doctor's approval. If someone has taken too much Nicardipine Hcl and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call 911 or contact your local poison control center at 1-800-222-1222. In Canada, residents can call their provincial poison control center for assistance. It's crucial to act quickly in these situations to ensure the person gets the help they need. It's important not to share Nicardipine Hcl with others. Be sure to talk with your doctor about any lifestyle changes that may help the medication work better, such as stress reduction programs, exercise, and dietary changes. Your doctor may also order lab and/or medical tests, like liver function, blood pressure, and electrocardiograms, while you are taking Nicardipine Hcl. It's important to keep all medical and lab appointments, so be sure to consult your doctor for more details. Additionally, it's recommended to regularly check your blood pressure while taking Nicardipine Hcl, especially when you first start the medication or if your doctor changes your dose. Your doctor can teach you how to monitor your own blood pressure at home, and it's important to share the results with them. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, skip the missed dose and take your next dose at the usual time. Do not take 2 doses at the same time. When it comes to Nicardipine Hcl, it's important to store it at room temperature, away from light and moisture. It's best to keep it in a place where children and pets won't have access to it. When you no longer need it or when it's expired, make sure to properly discard it. It's best to consult with your pharmacist or local waste disposal company for the best way to do this. And remember, don't flush it down the toilet or pour it into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.